For World of Work TV, I am Lenny Sanacola. Today I'd like to talk with you about some trends in the healthcare industry. First thing I'd like to talk about is telemedicine. Now, telemedicine isn't anything necessarily new. It's been around for over a decade, but what is new is its continual growth and application in both the medical and the behavioral healthcare space. So telemedicine basically uses electronic communications between provider and patient to communicate a variety of things. Telemedicine is a cost-effective alternative to the more expensive consultation between patient and provider in either an office setting or in a hospital setting. There are a variety of applications and uses of telemedicine, such as two-way video, email, smartphones, wireless tools, and other forms of telecommunications technology. We have seen the rise of telemedicine for many routine types of services as a low-cost alternative to non-emergency health issues that might take place at an emergency room or a physician's office visit. Basically, this is a virtual physician visit. Telemedicine works well for treating common conditions such as colds, flu, pink eye, and sprains. It is also a way to manage patient care for those with chronic illnesses that require daily monitoring and interventions to manage their conditions. Medicare and more private insurances are starting to pay for telemedicine services and incorporating them into reimbursement levels in health plan designs. The other thing to keep in mind is that it's projected by the year 2020 that there will be a severe physician shortage for primary care doctors, approximately 45,000 short. Adding specialties and other providers, it's projected to be short about 90,000 in terms of providers. So telemedicine hopefully can help in this respect as well. The next thing I'd like to talk about is just emerging technology. There's just lots of stuff going on in this space. The technological advancements are just growing at an exponential pace. There's a lot of self-monitoring tools that can be used by individuals to self-monitor their own illnesses, such as tools for determining ear infections, as well as tools that can regulate or track, rather, heart arrhythmia. This advance in technology hopefully will lead to the streamlining of costs, better provider and better patient care, and overall just more efficiency in the healthcare system. The digitization of healthcare continues, as well as the use of wearable technology. There are over 70 million people today that use wearable technology, either for calorie consumption, the tracking of sleep patterns, or the tracking of physical activity. Most people today have a smartphone, and smartphones can track a variety of things that can help an individual improve their long-term health behaviors. A smartphone today can even take EKG readings or blood pressure readings and can be used for a variety of purposes. As technological innovations continue to improve, that will create better access to data and health analytics, which can help with population health management. Population health management has to do with developing strategies and interventions to effectively improve the health of various groups of patients or define cohorts of individuals in an effort to maintain and/or improve the health of the individuals within that cohort at the lowest necessary cost. Let's talk next about patient-centered medical homes. The patient-centered medical home is an approach to healthcare delivery that involves a collaboration or a partnership between the patient and a host of providers along the healthcare delivery spectrum. Basically, it's a customized or personalized plan to improving the health care of an individual that involves collaboration with not only primary care doctors, but potentially pharmacists and specialists, community health resources, and a variety of other providers. The patient's wants, needs, and preferences are taken into consideration in the patient-centered medical home approach, and patients have the education and support they need to make decisions and really participate in their own care. With the patient-centered medical home, a team of care providers are wholly accountable for a patient's physical and mental health care needs. This includes prevention and wellness, acute care, and chronic care. Care is coordinated across all elements of the broader healthcare system, including specialty care, hospitals, home health care, community services, and supports. The patient-centered medical home looks to improve patient satisfaction and engagement. That includes seeking ways to engage with patients outside of a traditional office visit. In fact, even using social media to build relationships with their patients. Technology enables patients to reach their doctors through email, video chats, and after-hour phone calls. Mobile applications and electronic resources help the team stay on top of the person's health and the person's entire medical history. Next, let's talk about values-based benefit plan designs. Value-based benefit plan designs uses either incentives or disincentives to promote the use of more cost-effective services and consumer choices. Such designs aim to reduce barriers to maintaining and improving health. Examples may include covering preventive care, wellness visits, and treatments such as medications to control blood pressure or diabetes at low to no cost. Health plans may save money by reducing future expensive medical procedures. Lowering beneficiary cost sharing or out-of-pocket spending to increase medication adherence is another example. For example, to reduce the cost barrier to taking a prescribed medication, an employer might reduce the copayment for the treatment of some chronic disease such as asthma, cardiovascular disease, or diabetes in order to get the individual to stay on their medication. Now, the extra employer spending for that medication up front in the short term is typically outweighed by the savings that would be realized by reducing any future adverse medical events that might occur if the individual did not comply with taking their medication. Employee wellness programs continue to flourish. More and more employers are continuing to put them in place as well as enhance them. In fact, wellness programs really are starting to evolve to what's being called total well-being programs. So not only are the physical aspects in terms of diet and nutrition and exercise being looked at in wellness initiatives and programs have expanded to include financial wellness, emotional wellness, mental health wellness, community wellness, and social wellness, and even spiritual wellness. The rise in employee wellness programs, even though there has been controversy around the return on investment, continues because of the value and belief that they can not only control healthcare costs, but really can help to increase total health and productivity. In fact, there's been a movement away from looking at traditional return on investment metrics to measure success, and more of an emphasis on what's called value on investment. Value on investment would include employers looking at the following metrics for potential success. Outcomes might include increased productivity, reduced absenteeism, increased employee engagement, reduced turnover. The use of incentives to increase participation in wellness programs and in an effort to increase engagement continues as well. Outcomes-based wellness is growing much more slowly. Next, let's briefly talk about narrow and provider-tiered networks. Narrower networks typically reduce healthcare spending by restricting the number of providers in a network, thereby limiting consumer choice of healthcare providers. By narrowing the network, often the health plan is able to steer patients to lower-priced providers and give insurers better bargaining leverage with providers. Narrow networks typically exclude the highest-priced providers in a geographic region. In terms of tiered networks, in a tiered network, consumers have access to a broader network of providers, but pay somewhat higher out-of-pocket costs for the ability to see higher priced and or less efficient providers. The premium savings may be somewhat smaller, but the cost-quality trade-off may be more acceptable as compared to a narrower network. The issue surrounding narrow networks and or tiered networks is really being able to access reliable and credible data that gives you efficiency scores, quality scores for hospitals and doctors and other providers. So that sort of becomes a controversial issue when deciding whether or not to use a narrow or tiered approach, really having to determine the value, quality, and cost issues around the services being provided through providers and then sharing that information with the consumer. Other trends that might affect employers include the following. Defined contribution approaches to healthcare continues to grow, both within and outside of private healthcare exchanges, creating a one-stop shopping experience for individuals while providing more choice at a defined contribution level. Reference-based pricing is another item. This is where employees are provided with information on the quality and cost of selected healthcare services and the maximum amount employers are willing to pay. And finally, overall, employers can expect to see continued consolidation in the healthcare industry among various service providers, which will affect both pricing and access. In the end, there's many exciting things happening in the healthcare arena, and I just touched on a few of them. Employers, as well as all stakeholders, continue to look for ways to change and evolve healthcare delivery in order to make it more cost-effective, more affordable, and more efficient for everyone in the system. Only the future will tell how this will result. For World of Work TV, this is Lenny Sanacola.